welcome to Bone and Beauty. This is episode 3, part 2 about transformation. I'm Dr. Perry Godolvich.
You're a plastic surgeon?
I'm a plastic surgeon.
And I'm Dr. Marie Godolvich, and I'm an orthopedic surgeon, and we are identical twin sisters, and we're going to dive right in.
Yes. So in part 1 of episode 3, we talked about transformation. We spent quite a bit of time talking about height dysphoria because it is, I think, people have a lot of curiosity about it when they hear about what you do. And me too. I think it's just amazing what we have been able to accomplish. We also touched upon GLP-1s, which are the medical side of transformation, I think, today. In this part.
Yeah, we want to talk a little bit about the plastic surgery transformations, like
Yes.
nose jobs, jaw surgeries, breast augmentation.
So I didn't mention that in transformation, but I think breast augmentation is another good example of a transformative surgery. It's changing your biology. Some women are born with small breasts. Some women are born with big breasts. Some women like their small breasts. Some women like their big breasts. But then there are also women who big breasts are very heavy and they have a hard time carrying them around. That's breast reduction. That's also a transformative surgery. And then there's breast augmentation. So women who are very flat and feel like it removes their identity or their femininity identity will go for breast augmentation. And those are surgeries that are, I think, relative to, height dysphoria. The surgeries themselves are less difficult in terms of recovery. But
the impact is as big. It's probably big for a woman.
Huge,
the size
huge.
of her
Breast
breasts
augmentation
is a big one.
Yeah. So breast augmentation, I would say,
And something we
huge.
didn't talk about was proportion, because
So we're talking about that in episode 4, a lot about proportion.
Okay,
So
yeah.
and I think we'll touch more on those
sure.
ideals.
Yeah.
Where do beauty ideals come from?
But sometimes people also do these transformations to feel like their body is
proportions
back to their proportions that they see as
but also because we'll talk about in episode 4, like
the beauty ideas, of who decides what's what.
Yeah. So I do think that, like, of the types of surgeries I do, breast reduction has in plastic surgery literature has the highest satisfaction rate of any surgery we do. It is literally a weight lifted off your shoulders for women who are too big breasted.
Back pain. And,
Yes. But it's also the psychology. Like, they have always been viewed as a big breasted woman, and you have no idea unless you've been breasted, and I have had big breasts and I've had a reduction, how much attention it generates from men. And for somebody who doesn't want that attention, how it can affect your posture, how you wear clothes, how you want to wear baggy things to hide your breast.
Right.
And so that
so interesting, because the women who have no breasts would love to have those breasts.
Yeah.
And the ones that
they'd love to have that size breast. But
well, what's the size that what would you consider to be like?
Well, it's out of proportion, so it depends on, like, your proportions. But in general, most women want to be about a C. I would say, like, that's the commonest.
Already big,
yeah.
But also, like, how can you hold up a D forever?
Yeah,
like,
but I'll say that beauty ideals have impacted that hugely. I mean,
Yeah.
when you think back to, like, 80s and 90s, big breasts were, like all
Dolly
the
Parton.
rage. Yeah.
Yeah.
Today, that's no longer the case. I think people like to have, there are certain subgroups that really like the larger breasts, but the majority want a proportional size.
But also because, I mean, I think fitness has taken in a front seat in a way for women.
I also think it's part of the feminist movement to feel like we are not just our boobs. Like, look me in the eyes.
Yeah.
Like, so.
Yeah, but also to be able to do certain exercise, big boobs can make it really challenging.
Yeah.
Okay, and what about rhinoplasty?
Yeah, so rhinoplasty is a big one. I think it's like one of the biggest transformative ones. It's like your nose is smack in the middle of your face, but it really changes what people look like. It's always amazing to me when I do a rhinoplasty, like make a big nose smaller, remove a dorsal hump, and patients will be like, nobody noticed. And I'd be like, what do you mean? I'm like, you notice when you look in the mirror, like, yeah, I love my new nose. They can't stop taking pictures of themselves. But they'll be like, people just look at me and be like, oh, did you get your hair cut? Or did you go on vacation? Or like, it's even though it's like a central part of their face, when it's done well and it looks natural, it's like, this is what their nose should have looked like if it was the right proportion.
So interesting to say it, because sometimes patients ask me, like, how am I going to hide the fact that I've gotten my legs lengthened? And I tell them, for the patients that do 3 inches, you'd be surprised how many people don't actually understand what happened.
Yeah.
They just look at you in a different way and they say, oh, did you get a good haircut? Did
Yeah,
you look good? You look also, because now you have this confidence.
Yeah.
But yeah, it's shocking to me sometimes. But at 5 inches, you're in a different ballgame.
Oh, people notice.
Oh, yeah. That's like, you can't hide that. So that's why sometimes patients come when they're really young, because then it can sort of look.
Stigma for men also, it comes like, so men go for hair transplants.
Yeah, that's a very popular one.
That's a very popular one, and I would compare, like, it's really really hard to hide, and most people are gonna notice. Like
That
it's
you've
not,
gotten hair?
yeah,
Yeah.
like it's
Well, if
not.
you've been bald or half
I
balding,
have men who come for facelifts.
yeah.
Nobody notices. I have men who come for upper lower blepharoplasty. Nobody notices because they're restorative. That's
Yeah.
what you used to
Yeah.
like. But if
Right.
somebody is used to
Yeah.
looking at you
Yeah. We can talk about it.
bald,
Yeah. Yeah. For sure. That's
and all of a sudden
transformative.
you have hair,
Yeah.
like I think one of the famous people is like Jason Alexander,
I don't know what that is.
he's the guy on Seinfeld
Okay.
who's always balding. I mean,
Yeah.
literally, he's the
Yeah.
balding guy on Seinfeld. Like
Yeah.
he's got like,
Yeah,
and
that's
then
part of his identity.
yeah,
Yeah.
and then he started doing stand up comedy, and he shows up on stage with hair.
Oh, really?
Yeah, and
Oh,
so he has to
but
address it. He
right.
has to address it. He has to be like, "Is this a toupee?" And he makes a joke out of it, and he does
I
the whole
tell my
thing.
patients, you're better to own it, and you get to say how you want to, than hide it and somebody sort of. But that's a whole other debate.
Yeah, but I
But
don't have to have those like for the majority of the surgeries I do. I have to say like most people don't notice.
yeah,
And
because it's
it's
smaller transformations.
yeah, yeah.
Except for the nose job. The nose job for sure.
Yeah,
People
I mean,
notice.
obviously, trans surgery,
Yeah,
no, but
yeah,
like,
yeah.
but even nose jobs, like people don't notice. Like it's surprising, but people just say you look
Yeah.
because it's the nose still has to fit your face.
Yeah,
Obviously, if your nose is
So this is
disproportionately
where this is where I want to go with this episode, because now we've talked about what kind of surgeries are transformative, but what we really want to discuss is, okay, how do we decide yes or no for a patient? How do we decide what's the right fit for the patient? When are you going to say, no, I can't do this for you, go find somebody else? Like that
so as a
that
plastic surgeon, so my
decision
main, yeah.
framework.
So I have to understand their motivation for surgery, like you. I think that the knowing, is this something that causes you distress? Is it a very specific concern and not like just a generalized depression? So for the motivation for surgery, that they've considered this for a while. It's not like a fluff decision. Like it's not they saw it on Instagram and all of a sudden they're ready to change. That they understand what they're getting into. That's our job as surgeons to understand the risks and the complications that are possible. But
But
so
what if they ask you for something that you don't think is
that's the thing. So for an aesthetic surgeon, I have to agree with your aesthetic. So I'm going to go into much more detail in our what is beauty ideals, but I'd say like I need to see what you see. So I tell them like give me an inspiration picture. And if what I see is not something that so for example, a woman, I don't have a lot of this thankfully, because in the end what ends up happening, and God is great, but women who have my aesthetic will come and see me. Women who don't have my aesthetic go see somebody else, thankfully. But a woman who comes in and wants excessively large breasts for her frame, I will warn, like,
So I would see this all the time in Dallas when I
yeah,
came to visit you.
yes,
The man comes in with the woman. The man says she wants this size.
yeah. So
And it's the size that the man wants for
yeah.
his
So
for the
I don't have a lot of those patients, but
yeah.
I would
Sugar daddy.
I would not operate on a woman who cannot herself say what she wants. Like
Yeah.
that's not happening. But I will go through like there are actual medical complications. It will thin out your tissues. You will get totic, like you will set, the bigger they are the faster they fall, like it can harm your shoulders and posture. Like there is real issues of having very large. Now like I said, today the trend is no longer that,
Yeah, thank God.
thankfully.
Yeah.
If anything, we're on the opposite trend of doing like
But like
very
has a
small
patient ever
augmentation.
come in to ask for something else that you're like,
Yeah. So the things so I'll tell you about some of the trends now in plastic surgery that I'm worried about. But like I've had patients email us say like, can you remove my belly button? This one will help. Will touch home
I
with
would
you.
love that. I have belly button phobia. I absolutely hate belly buttons, particularly the innies. I have like, I
Yeah.
can't touch it. You can't talk to me about it.
I am like,
And when I first saw Perry do an abdominoplasty,
yeah.
I was like, why do you reshape the belly button? Just take it off. Take it out. I would be so happy without a belly button.
Yeah, so I guess that's the only way in which you can remove a belly button and not be like, if I have to remove your belly button, I'm leaving you with a scar in the middle of your tummy anyways. Like,
Not unless you're doing an abdominoplasty.
no, not unless I'm doing it. But this person didn't want an
Yeah.
abdominoplasty. They just wanted to remove their navel. There is no way to remove your navel without doing an abdominoplasty.
Maybe they had belly button phobia.
Okay, but it's not.
I would prefer to get a tattoo
So
of my belly
I
button in
do-
3D than have a real
yeah.
belly button.
So, like, I think as a surgeon, I respect anatomy. There are certain, I respect, those are proportions, those are anatomy. Like, so this is not something that I'm comfortable doing because I don't know, like in 20 years, it's just like a tattoo. Just think about it. Like today, you don't like your belly button.
No, I haven't. Yeah, this is a lifelong for me. I'm not
I
doing
understand, but it's not like a common thing.
No.
And it's, yeah. So for me, that was like I can't do that because aesthetically it makes no sense to me.
Right.
People have asked me for Spock ears.
Oh,
Yeah.
interesting.
Yeah. So again, that's not a human anatomy that I'm comfortable transforming
And
into.
they want this because
It's like I don't know.
thing. Okay,
Yeah,
they're part of a
yeah.
whatever.
Like, and it's okay. It's
Yeah.
just that I
Yeah. You need to be
I have
okay
to
with
be
that.
comfortable. I also don't know what does an aesthetically good looking spockier look like. It's not my aesthetic.
Right.
So
So you don't know how to,
I
yeah,
don't know
you
how to,
can't guarantee that
yeah.
you'll be able to do
So
what they're
like if I
looking
can
for.
visualize it, I tell people like plastic surgery is visual. If I can visualize what you want, I have a better chance of
But you know
getting
what
there.
Spock looks like.
I mean, kind of, but what is an aesthetically good looking spockier?
Yeah.
Do you know different spockier? Like, I don't know. Like,
Yeah.
what is a nice spockier? What is an ugly spockier? I don't know. Like,
Yeah,
yeah.
that's pretty
So,
interesting question. I have patients come see me sometimes with some strange demands like that for the limb lengthening also. Like, oh, we already did like the 7 centimeters here and 6 centimeters here. Can I do it again? And then I'm like, no.
no.
Like, there's a limit to what I'm willing to do, how much your body can
Yeah,
take.
because
And
we
also,
have to
you need your
evaluate.
arm length
Yeah.
and you need your trunk length.
Well,
And
we
it's
have
just too
to evaluate
much.
risk versus benefit, right?
Yeah.
So at some point, when you have a psychological distress, or if there's this one specific thing that bothers you, and there's a solution that
And
the
we
risks
fixed it, and
are-
you come back
yeah.
and you're still looking for more.
Yeah,
That's
yeah.
always a bit of a
But
tricky
those are
one.
not. So there are some, like yesterday I saw, and this is the thing, like I guess as a plastic surgeon, Instagram targets me with all these things all the time. But there is somebody doing shoulder reduction.
Oh, I get people asking me all the time about lengthening their clavicles because they want to bring their
The
shoulders up like
opposite,
this.
though.
Oh, like this now?
Yeah. So
Oh.
they're fracturing the clavicle, removing a piece and closing it to some like a woman who has broader shoulders to make her look like.
But the problem is it won't.
I know the
It's
picture was awful. The before and after was awful.
yeah, because basically cats have no clavicles. That's
Okay.
why their shoulders are in front of them. You
Yeah.
don't need your clavicle,
Yeah.
but then your shoulders are going to be coming to the
so
front of your
it was
body.
very rounding. Like,
Yeah.
so I didn't find it aesthetically pleasing, but I
No,
also
it's
think
basically
like,
going to give you a humpback. It's
I
not a
also
good
think,
idea.
but Marie, like it's
The
a little
people-
crazy.
No, but people ask me all the time if I can lengthen their clavicles. That's one of the ones that I get because they want to do this. Yeah, because it's going to push the shoulders back.
Oh, I want that.
No.
But
Yeah.
so like I just feel like it's for me that's like an exaggerate, and it's not just makes no anatomic sense. Like the clavicle has a function. There's like a big vein under there. Like it
Oh,
just
no, yeah,
scares
yeah,
me.
yeah.
Like
I
I
mean-
just like so the other thing that's very popular right now is rib infracturing. So there was
In fracturing?
so at some point it was like we remove ribs to make the waist smaller. I was never on board with that. I feel like again, like that's aggressive. Like, so for me, it's risk versus benefit. It's not that I don't understand the aesthetic interest in that. Some people are very square, not for a woman who already have curves, but some women who already have curves want to be like so tiny that it's just proportionally makes no sense to me, and I think that's too much. That's where I draw the line. But for people who are very square. In the trans community, for example, from a men
Yeah,
to
so there are some
female,
gender affirming
yeah,
surgeries
so
that
but for me again that's like a risky surgery. So now they've developed it to the point where that you can do it just like percutaneously.
because it's a very easy the little ribs
Yeah,
at the bottom
so
are easy to take out.
percutaneously, and you just infracture the rib. Is there a zero chance of pneumothorax? No, like there's still a chance of
No, at that
pneumothorax.
bottom is no.
No, it's still a chance of
Yeah.
pneumothorax. So they do it on the backside and the front side in order to really bring in the
Like a floating rib.
yeah.
Oof.
So for me as a surgeon, I just like I respect my carotids, and like that's just too much stress for me. Like I'm not going to do that. I understand it,
Yeah.
but that's where I draw the line on things that.
So
like,
I mean,
I'm
you
not
can
comfortable doing.
you can not pass judgment, but still say that's not for me, and I'll refer you.
Yeah.
Or you can go
Another
see somebody else.
Example, and this is something that I do educate patients about, the high definition liposuction. There is now like a whole. So it started off by saying, okay, we're going to sculpt into the fat what your abs look like. But fat is not muscle. So it looks great on Instagram. And then you gain 5 pounds and you look like you have lipomas. You look like Frankenstein. You've gone from something that
But you can take it out again, no?
not really.
No?
It's like really hard to fix.
Ooh, so you would have a 6-pack.
Yes,
That
but
could be
it's
cool.
it's made of
I understand,
fat.
I
So what I tell patients is like I can
So when you
thin-
touch the abs, they're not hard.
no. So I can thin you out and you can then work your abs and you will see them through the thinner subcutaneous tissue. But what they're doing now is they're taking that fat, and instead of like putting lines into the thing, is they're taking that fat and they're putting it into the muscle, and it's called muscle volumization. So they're bulking up the muscle
So that it looked like
with
abs.
fat.
Huh.
Yeah. I will say
That's called fatty infiltration in the muscle. That's not great for the muscle. You're losing muscle strength.
So what they say is not a lot of the fat is left. It just like increases vascularity and makes the muscle bulkier. I don't believe it. I am a person who is like very traditional in terms of my surgical understanding of things. It's like with like you have to respect anatomy. So when I take off fat from one place and I put it somewhere else, I put it somewhere else that has fat. So if
Yeah.
I'm putting it back in the boobs, Boobs
Yeah.
are fatty. If I'm putting it back in the butt, fat is fat. I'm replacing like with like. This idea of like replacing muscle with fat
No, no,
or
that's a terrible idea.
making fat into muscle, it just doesn't, there's no sustainability there. It's not durable
And it's
and
not
you're
real.
going to
And
have problems.
yeah,
Like
for
you're going to
sure.
have, you're creating problems. And some of these, I see some of these before and afters and they look like Frankenstein, Marie. Like they look like
So this is
Frankenstein.
the thing, Perry. So this is where the ethical debate comes in, okay? So just because you can, should you?
Yeah.
And I really struggle with this one. Like, if limb lengthening didn't exist, if you didn't have a choice but to live with your height,
Yeah.
would you pursue it? Would you have that mental burden as much? It's like a chicken or the egg debate. Or like if a tree falls in the forest and nobody's there to hear it, did it actually make a sound?
So yes, so I will tell you, like when we do the next episode and we talk about beauty ideals, where did beauty culture come from? It was always there. There
I know.
is always there. Now it's become,
But once you have a solution, do you
yes,
create more of a need? Do you?
for sure, 100%. It's not that you create the need; is you make it accessible.
Okay.
It used to be not accessible to everybody, and now it's becoming more and more accessible. So, and
But
then,
but now that you know that there's a solution, like in my brain, if I was
somebody like, but think about it. Like before, people were allowed to be gay and lesbian. Was did it exist?
yes, of course.
Okay. So now it's accessible in the way that it is acceptable. You can create communities around it. You can live your life that way. But did that need, was that there?
Yes.
Yeah. So I
Yeah.
think in the same way, like, were there less people?
Wait, but are there more gays and lesbians now because it's more acceptable?
I don't know, but I don't think so. I think that,
I think so.
oh, maybe, but maybe, so maybe people who used to feel this way, like, because it's a spectrum, the people who
Well,
are
because
less
the
on the
way
spectrum, they shut it down.
correct. So
Psychologically.
because of
But
societal ideals.
is that healthy?
No, no, I agree.
Okay,
There are
so,
more people that have accepted to be able to live this way now because they have the option.
yeah.
Yes, I think there are more. The gay community has grown because there's more, well, maybe they're more open, but also I think because people don't automatically assume that they're going to, as a little girl, get married to a man. That changes the way you're socialized. That
Mhm.
changes the way you're going to eventually choose your partner.
100%.
But in the same way, when you have the solution,
Mhm.
then the distress becomes more distressing.
Correct.
So that's
Yes.
something I struggle with a little bit because it's especially given that what I do is so it's accessible to a certain extent, but it's so expensive
Right.
that it makes it
But I think that
ethically
that's the
challenging.
beginning, because you're still at like the beginning of this curve. I think eventually things are going to be
More accessible, less
less
expensive.
expensive, just like other things. So I don't see it that way. I think that society continues to evolve and progress, and that medicine has to continue to evolve and progress too. Like we have to be there for these needs. Like,
Yeah, but
like
going back to your point about the things that you're willing.
people didn't used to go to the gym. People didn't talk about wellness. People didn't go to therapy. Like all of these things,
Yeah.
did people have just as much difficulty in life and psychological issues?
Yes.
For sure.
Yeah.
Does that mean that because medications are available today to deal with depression, that there's more depression?
No. I
Okay.
agree. Yeah. Okay. Yeah, I understand. Yeah. Okay. But to the point of what you're willing to say yes to and what you're willing to say no to a certain extent, it comes from also what you believe,
So
but it's a
it's
bit of judgment on what you think
It's
is.
not judgment. I try not to make it about judgment. I try to make it about, I have a skill that I can apply to your distress, like, so your issue. If I think that my skill is aligned with what I can provide to
Right.
you, then I say yes. If your aesthetics are so different than mine that I don't know that I can do what you're asking me to do, then you should find someone whose aesthetic is more aligned with yours. Not
Just-
because I judge you,
Yeah, I
because I
understand.
don't think that I can like physically give you what you're asking for.
I agree with that in the sense that I also don't think that
the
all people.
risks are where I think that the risks are too high for what
Right,
what
right.
you're getting.
But like people look at what I do and they think the risks are too high.
Correct.
Right. But that's an
miseducation,
education
yeah.
thing. Yeah. So
Is that a word, miseducation? No,
Yeah.
it's not. Okay. Yeah.
lack of education.
Lack of
I think miseducation is.
Okay.
I think that, yeah, similarly, like I have patients that'll come, and even though I can do their surgery, I choose not to because it's not the right fit. Because either their expectations are not, or whatever it is, it's not the right fit. And so that comes down to.
Yeah, and then we've talked a little bit about body dysmorphia, which is like the type of patients that I
Right.
for sure say no to, or a patient, like I say, an unhappy person. So like if their outlook is negative and they're unhappy and they think that this is going to fix everything,
It's not going to fix everything, even if you fix this one thing. Yeah. Well, that's a little more challenging for sure.
Yeah.
Okay. So, in terms of ethics, do you ever have like a real internal problem with any of the stuff that you do?
So we'll talk about it in beauty ideals because when I was applying to plastic surgery, I feel like there was judgment around me from other doctors
Yeah.
about the aesthetics of plastic surgery, like of going into a field where you're offering aesthetics as a medical field.
Right. So that's a huge debate in and of itself.
Yes.
Cosmetic surgery, period.
Correct.
Yeah.
And that's always been a debate with cosmetic surgery, and that's where it's good and that the cosmetic and reconstructive surgery is one specialty in one field because it is, if you can accept that somebody who is disfigured wants to look more like themselves. So, specialty started with surgeries post-war. So, and or even before that, back like a long time ago, where people had syphilis and lost the tips of their noses, and like the first reconstructions were reconstructing tips of noses. So, like, if you can accept that somebody's
Similar to limb
losing,
lengthening.
yeah, somebody's losing their identity from sickness or trauma or cancer or war or whatever, and we want to make them look back to human or to the better version of themselves, it's not such a far leap or hop away to say we want to make people look like better versions of themselves from
Except,
aesthetic.
except
Yeah.
when you do cosmetic or aesthetic surgery, you're taking somebody who's perfectly functional, normal human,
It's the distress.
and
We've touched on
yeah,
this.
yeah. And you're potentially, if they get a complication, putting them in a position where they're no
That's our
longer.
job as a surgeon to evaluate, is the risk big or small? So like I'm not
But the
taking
risk is the risk, Perry, for like in limb lengthening,
yeah.
when something goes wrong, I mean, if I have a patient who's not healing their regenerate, it's extremely stressful for me.
Yeah.
Because now I have a patient who might have a functional problem.
Yeah.
That they have a non-union or they have and I've created that by doing the surgery for them to make them taller.
Yes.
It's very distressing to the surgeon.
Any surgery. Really, like if I
Yeah,
have
but I have less issue with that when I didn't create the problem.
for sure.
So like if they come in and they have a limb length discrepancy or already have a non-union or they already have an infection.
For sure.
Yeah. So yes, I'm fixing their internal distress, but now I'm creating internal distress in myself
Yeah.
for, doing a surgery where there
the
might
standard
be
of care
harm.
and the verification of the motivation and the making sure, like our consent forms are 20 pages long, like
Yeah,
making
but
sure
forget
that
the consent form. The way I feel about it doesn't change whether,
No.
yeah, the patient consented to it or not. Because what do patients really know at the end of the day?
Yes.
Even though you tell them,
But that's where I say, like, I have to evaluate, like, what is the risk we're taking? And the best
So-
thing, the best metric that I have for myself is what risk am I worth taking on my own health, knowing everything that I know. I've seen the complications. Did I get a tummy tuck? Yes. I've seen the complications. Have I had liposuction? Yes.
right.
So
Right.
I,
Well, I haven't had limb lengthening,
yeah.
but I obviously feel that the risks are not that great, but anyone who looks at it from the outside in orthopedics doesn't agree. But they
So-
also don't agree because they have knew nothing about limb lengthening and they wouldn't agree to lengthen somebody's one leg if they was shorter than the other.
I wouldn't agree to go bungee jumping. I wouldn't agree to, like, there are things that I'm not, those are
Right.
risks that I don't think are worth taking. And,
Right.
and yet there are so many people who do those things, right?
Right.
So like again, it's about alignment of like that person, their risk, their ability to take this risk is they determine it as a reasonable risk.
Right. All right. Okay. So I guess at the end of the day, both the surgeon has to be comfortable with it and you have to have a patient that's having, I guess, a reasonable, to a certain extent, request. Things that are unreasonable to you are things that you're
So
not.
like I'm not going to do the rib breaking. I'm not going to do the shoulder breaking. I'm not going to do the muscle volumization. I'm
Yeah.
not going to do things that make no anatomic sense to me, no aesthetic
And the
sense
risks
to
are
me.
too high. What if they
Where-
show that the
where
risks?
I think that there can be harm, like there's serious harm that can be caused by these things. For me, those risks are more than the benefit.
Yeah. But limb lengthening has those risks. I mean, at the end of the day, if you don't heal your bones, you're still walking, but I need to do multiple more surgeries to get you where you're going. There are significant risks.
Right. When I have, like it's not like there's no risk in a facelift. Okay, there's a risk of injuring a nerve.
Right.
The person is going to have like it could in theory they can have facial paralysis,
Yeah,
right? Like
yeah.
most of the time that comes back. Like you can damage one nerve, but not all five nerves.
Yeah, yeah.
Is it possible?
Yeah.
Sure. Like,
Yeah.
can you lose half of the skin of the face in a facelift? I mean, it's never happened to me, but can it happen?
Yes.
Like those are disfiguring. Like
yeah,
like,
if you get a complication.
yeah, and I've seen, but people, I hate this word, but botched surgeries, like where it's really hard to fix
Yeah, I
something
see a
that's
lot
been
of that. That's the
done.
reason I'm doing
Yeah.
limb lengthening in Canada.
So, is it possible to cause harm with aesthetic surgeries? 100%,
Yeah.
because no,
Because surgery is not it's not Walmart. There's no,
there's no money back
yeah,
guarantee.
yeah.
There is no way to know with 100% certainty that you are not going to get a complication.
Yeah, but I struggle with that with aesthetic surgery. I'm getting better at it, but because a lot of the surgeries that I was doing before were for medical need and not necessarily psychological need. I struggle with that. I
Mm,
struggle with that part where, I feel extremely responsible if something doesn't go right with
for
the
sure.
patient. And even though sometimes it's the patient's fault and sometimes it's not, I I still feel extremely responsible and very guilty about it when something goes wrong.
100%.
Yeah.
Yeah, I say, like, I have a no complications policy. I wish I had no complications all the time, because it's very tough as a surgeon to deal with complications. I find that the difficult part, because at least in plastic surgery, everybody always pretends that they can never have any problems in their practice. They never have any complications. You go to these presentations and nobody's really honest about what the crap that they've had to deal with, or like difficult patients, and that part is isolating. So when you have a complication in plastic surgery, because it's such a competitive field, it's hard to call up a friend and be like, "Hey, what do I?" Thankfully, I have
Yeah.
you. Like,
Yeah.
I
Yeah.
bounce ideas off of.
Yeah.
But in plastic surgery, there's this idea that, like, you should never have
Yeah.
complications, and I find that awful. That's
But
awful for our specialty. It's just
everybody has
awful.
complications.
Yeah.
If you're operating, you're having complications. So that's just the way it is. Now, I think it's healthy for us to feel this way. Otherwise,
I
probably,
need to feel respond. I always say, like, a complication is something that I did not control for. So
yeah,
I'm not saying that it could be something the patient did unusual. It can be a technical thing that, like, I did not control for. I'm like, for example, I am, I'm obsessed, and the anesthesiologists hate me with blood pressure during surgery,
yeah,
because blood pressure is something that we can control. But if you're
right,
not paying attention, it can cause a hematoma.
right,
Like, so there's something that is not controlled. And so we use complications as a way to look back, like, what else could I have controlled to prevent this from happening?
right.
But the reality is, it's just like airplane crashes.
Yeah,
Like,
yeah,
something did not get controlled here, but do
yeah.
accidents
Yeah,
happen?
but sometimes complications have nothing to do with the technical or they
Yeah,
just
the
happen.
body. The
They
body.
just
There's
happen.
so many things about the body that we don't
Yeah,
control. Like,
yeah,
how why is one person healing while one another person is not
yeah.
healing as well, right?
That's the challenge. And I think as surgeons, it's nice to go back and try to figure out what we did. And we always try to blame ourselves. But at the end of the day, most of the time
Mhm.
at this point in my career, 15 years more in, I've seen pretty much every complication and I know how to
And
deal
that's
with
what I
them.
tell patients. I'm just like, if you go to a surgeon who said they never have complications, I remember choosing the surgeon for Zach's circumcision, right? And I had the option between, like, this one guy in Vancouver who was like a urologist, and the Rabbi Mohel, who's not a surgeon but trained on doing this procedure and does thousands of them.
Yeah, exactly.
And my only question was like, what kind of complications have you seen? And the urologist blew me off. And the Mohel explained to me every single complication he'd seen in 20
Exactly.
years. And I was like, I want the guy who knows what the complications are,
And knows
who
how to treat it.
admits the complications and knows how to
Yeah.
treat them.
So that's what I tell patients. When patients come to see me and they ask me about complications, I can give you the whole list of different complications, but I can tell you what has happened,
Yeah.
what complications we have had, and how we have dealt with them.
Yeah.
That I think is always the better
Yeah.
approach.
And I want the surgeon who knows what to do when this
Yeah.
complication happens.
But
Like,
one of the challenging groups of patients that we haven't talked about yet in terms of transformation is the
yes.
revision patients.
Yeah.
Patients who come to see you, and we haven't talked about regret also, which
Yeah.
we should talk about. But
Yeah.
revision patients, they've chosen somebody else to do their initial surgery. I see this all the time in limb lengthening. Patients go to, unfortunately, because of the cost, they'll go somewhere that's more cost effective, like and they get surgery done in Turkey or in somewhere else, and they'll come back with, I don't know if it's botched surgery so much so as perhaps they didn't follow all the rules exactly the way, but they come back with complications that they haven't been able to solve there, or perhaps because the patients don't want to stay there anymore. And oftentimes patients who have a complication
Lose
will go,
confidence.
they lose confidence in you and they'll go see somebody else. And then that surgeon, if they will tell them, oh, your surgeon's terrible, and so on and so
I
forth. So
really try not
I
to
try
do
not
that.
to do that also. But if they come and see you and they've had, significant complications, then fixing the complication is also a very tricky thing.
Yes.
Patients have very high
Yeah.
expectations.
So there was a plastic surgeon at a female plastic surgery meeting who says, like, I always tell myself, if I'm taking on a revision, like a patient who has a poor result, that monster is now becoming my monster, because they will no longer remember the other surgeon who
Correct.
botched them. Everything after this point that I've operated on them is on me.
Yeah, correct. And so that's really challenging. And often it takes more than one surgery to fix, and patients want a one and done.
Yeah.
So because they're so tired of,
Yes.
and so that's a real challenge.
And they've also been disappointed and let down. Like, they had this whole transformation planned and it
Yeah.
didn't go as they wanted. So I
Yeah.
understand that kind of
Yeah.
Yeah,
That's
they're more
really
skeptical
challenging. Yeah.
of any surgeon. They're more
Yeah.
skeptical of medicine. They'll look online and find like all kinds of
Yeah.
like yeah.
And now
So
ChatGPT, they get all
mm,
kinds of solutions going. So
I think ChatGPT is fairly good.
yeah,
Yeah.
depends what prompts you put in it.
Yeah,
So it
yeah.
just depends. Yeah. So revision cases
Yeah.
are much more challenging. And
Yeah, so
that transformation
my
fail
general yeah.
makes it a lot more challenging to get them where they want to
Yeah,
go.
so the conversations I have with them is that I'm not here to give you the original transformation.
Right.
I am here to make what you have now better.
Yeah.
And I will never be able to give you what you originally aspired to.
All right.
And
And that's a challenge,
that's a
especially
challenge.
with the height patients. I
But
mean,
they
they
appreciate the
hold on to every
honesty.
millimeter, even though
Yeah.
now we need to maybe lose some, you know?
Yeah,
So
but they do appreciate the honesty because they'll have seen two or three other plastic surgeons before who promised them the moon, like
mm,
to get their business, I guess,
right.
or I don't know.
Mm,
And like I'm honest. I'm like, this is where I think I can get you to, and it may take more than one surgery. I'm not a person who like a lot of plastic surgeons will charge a lot extra for revisions. I don't. I charge what I would have charged for the initial surgery, or sometimes a bit less if I have less to do.
yeah, I usually have a lot more to do, but yeah,
Yeah,
I try to
yeah.
make it cost effective for them also because I feel bad for them,
Yeah,
right? Like
exactly.
it's, yeah.
And I feel like that's where I feel like I'm responsible for my field. Like, so for example, women who come to see me and they want their implants out, even though their implants are fine, like I'm not going to judge them. Like, you want your implants out, you want your implants out. Like, I am responsible for my field. And most of the time, if I'm doing a lift and I can just remove the implant, I don't even charge for that. Like,
Right.
so I'm responsible for plastic surgery. Like, I'm
Right.
giving plastic surgery a good name. Like, we are doctors. We are,
Right.
yeah,
Yeah.
yeah.
Which, yeah.
Yeah, so I always say, like, for me, this is where I feel like I feel a much more closer to my female colleagues. There are some great male plastic surgeons, but I don't
In
see.
aesthetics, you're talking
Yeah,
specifically?
I don't see. I don't see myself as a salesperson, and a lot of plastic surgeons do. I think that when you forget, like when you're thinking about this as a business and not as medicine, you lose your sense of doing things for the right reasons. So
That's a very important ethical point.
very important ethical point. So, do I run a business? Yes. Do I get and I tell patients this all the time. Do I get paid well for what I do? Yes, but I have never said yes to a surgery for money.
Yeah.
Ever. That
That's the
is
same for me.
not I don't remember.
Because
Like
it,
I
in the
know what
end,
my prices are because patients ask me all the time. But I don't even know when they paid or they didn't pay. I leave that part completely aside to let my admin deal with that because I'm not doing your surgery for the money. I do your surgery because I think that our goals are aligned and that I can fix a problem that you have. I have solutions. You have
we're
a
offering
problem.
a service. Yeah.
Yeah.
It's a service
It's
offer.
more than it's not a service because service makes it like client.
No.
Well, this is a doctor patient
True.
relationship. Yeah.
True. True.
And it's a different type of contract because I tell them when you have a complication, it's 100% you. It's no longer 1%,
Yeah.
right? It's
Surgery is not a haircut, is
yeah,
what I tell them
it's
also. Yeah.
100% you. And in that case, what I cannot give you your money back. I
Yeah.
cannot. What I can do is you and me are now in a different type of contract where I'm taking care of you and making sure that to get you through this complication, you have
Right.
to trust me.
Yeah.
So it's a different type of contract.
For
It's
sure.
not a it's
Yeah.
not a client
Yes.
contract.
I agree.
Yeah.
Yeah. But
So it's not a service industry. And when people
yeah.
so
Yeah,
yeah.
it's true. You're right. You're absolutely right. Yeah. But that, I'm not sure how the rest of your plastic surgery colleagues see aesthetics, but I can tell you in orthopedics, it's extremely new to talk about aesthetics.
Yes.
So it's like, the people see it as a money
Aesthetics and
grab,
plastic surgery is similar.
but it's definitely not a money grab. If I say no, like I don't say yes to patients unless I think I can really help them.
Yeah.
I had a patient come see me not long ago in late 60s, wanted to do this. And I said, no, it's too much of a risk. And I'm not looking
Yeah.
to have problems. Like it's only good for me
Yeah.
if it's good for you.
Yeah.
If it's going to be bad for you, it's going to be bad for me because I'm the one that has to manage all of the rest of those. I don't want to have
And the
any issues.
sleepless night.
And I worry about it. And exactly. So that definitely that's the right approach. For
Yeah. So I like one of the things that, it doesn't happen often, thankfully, but if a patient is unhappy with me, like, oh, you just wanted my money. Yeah. No, you do not know me.
Yeah.
If you think that at all about me. Like,
Yeah, I think, but unfortunately, we do make a good living, and so some of that always comes into play. Unfortunately, but see, well, maybe they'll get to know us better with this podcast. All right. So I think we've talked about who's not a good candidate. We've talked about mental health, which was very important. We talked about that in the first episode. We can touch on that again, but surgery is not a solution for any kind of mental health crisis. When we talk about distress for these patients, we're talking about patients who have a specific distress. That's not something that's going to affect their entire life. It's not causing massive depression, although in some cases in my practice it is. And if they come in and they're either suicidal or massively depressed, they need medical treatment first. They need psychologists, psychiatrists. They need to be treated. They need to have a stable mental health status before we go into surgery, because whatever it is going to make it worse.
Mhm.
So we've talked about which candidates also are not good in terms of their expectations. So
Yep.
people who are like, expectations are not aligned. It's all an alignment thing. And I love saying alignment. Then that's not the right fit, and you can go see somebody else. So let's talk. The last part is always our myths and myth busting section. What are the myths about aesthetic surgery, the ethics of aesthetics?
Well, I do think that one of the myths is that the aesthetic surgeons are like salesmen, like that we
Yeah, we're
sell.
just business
Yeah,
people.
and that maybe that is a very because of it's a competitive field and we're on Instagram and like I would love and I consider doing this sometimes, but like Instagram, you only show your best results, and it's like unfortunate because that's not
Well,
real.
you're not going to sell the.
Right. I mean, that's where like I feel like no, we should talk about complications on Instagram. We should talk about like the other parts, and that's a little bit what this podcast is about. Like it's not like when I talk to a patient about surgery, I don't just show them my good results. I show
Right.
them what a bad scar will look like. I will show them what
Some
complications are
patients really
possible.
want to know worst case scenario, and I can tell you some patients do not want to know.
I don't know that they don't want to know, is that they're not hearing you. So I will still
Oh
say
no, I have
it.
patients that say I don't want to know.
Yeah, well,
Yeah.
I tell them you need to know.
Yeah, of
Like,
course.
so
You
you
need to know
tell
what
them
you're getting yourself
you need to
into.
know what you're getting yourself into, but I'll tell you that they don't remember. Like, they don't think
Yes.
they hear it. Like, it's theoretical.
Yeah.
Like when you see a plane crash and you're like, it's not going to happen. I'm okay to take the plane tomorrow. That's not going to happen to me, right?
Right. It's the same.
You don't know. It's the same.
Yeah.
It's like
And I use that line all the time. Yes, I have 1% chance for this to happen, but if it happens to you, it's not 1% the problem. It's
Yeah.
100% the problem,
Yeah.
and it's 100% now our problem.
Yeah.
So, yeah. Okay. So that's definitely a good myth.
Yeah.
What other myth would there be? Surgery is not a solution for.
Well, like liposuction is not a diet. I always
Yeah,
say
yeah,
like
yeah.
liposuction is sculpting.
Yeah.
Yeah, and like I'm like I come back to it. Like if you're not a happy person, I'm not about to make you happy.
Right. So
You
we
have a
can
problem,
change.
I have a
So
solution.
transformative surgery can make some impact on your life. It can be
Quality of
massive.
life.
Yes.
Quality of life. It's going to improve your quality of life. It's not going to
Yes.
take you from being angry, depressed,
Right. Right.
isolated person to all of a sudden a social butterfly.
Yeah, I agree. All right. So transformation is a very powerful thing. Knowing when to do it, when not to do it, which patient is the right patient for it, which patient might not be the right
That's the other
patient.
myth is that people often. Do you ever say no to patients? All the time. And
Right.
they somehow think that because I sell plastic surgery that I just do whatever patients
So,
want.
yeah.
Yeah, I don't sell plastic surgery. I offer solutions to aesthetic problems or quality of life issues. But it's a doctor patient relationship.
Yeah.
Yeah.
And I think that sometimes other people forget that, but for us, it's extremely medical. Like
Yeah.
we're not, and we don't think about the money.
No, we
One-
think about risk versus benefit.
Yeah, exactly. Specifically for each patient. So the big question, and this is what we're going to tackle in episode 4, is why? Why do people have these ideals? Why do we all try to fit these beauty ideals? Where does that come from? And in episode 4, we're going to dive in and really try to figure out how we get socialized to this, where these ideas come from and how they're changing,
Yeah.
both through culture and time.
Yeah, and I think like the plastic surgery perspective on this and the history of plastic surgery is super interesting, and figuring out how that affects beauty.
Yeah, and I think there's some in orthopedics as well. So
Yep.
we're going to get into it at the next episode. So join us next week for episode 4.
Yeah.
Thanks for joining us. This is Bone and Beauty.